According to the Center for Disease Control and Prevention, about 130 million adults in the United States are living with diabetes or prediabetes. This begs the question, how do I know if I have prediabetes? One of the most frequently asked on health channels. It is important that you know these symptoms of prediabetes as it will help you in prediabetes prevention and consequently in preventing diabetes. In this video, you will discover 6 prediabetes symptoms you must know before it's too late. Number 1. Unusual thirst. Thirst is a sign of health, but when you have to drink water more frequently than you used to, then you may want to go for a prediabetic check. Unusual thirst occurs as a result of your body trying to reduce the concentration of blood sugar. The body does this via the action of the kidney's blood filtration mechanism. When someone has prediabetes, that is, having high blood sugar but not up in the range of diabetes, the kidney is forced to flush out excess blood sugar by frequently filling the bladder with urine. Urine comprises about 90 to 96% water, which means that your body loses a considerable amount of water anytime you urinate. To replace lost water, your brain triggers the mechanism responsible for the feeling of thirst. Number 2. Blurry vision. Our eyes all have lenses which focus light into the eye for vision. However, when blood sugar rises due to prediabetes, it causes the lenses of our eyes to swell. When this happens, you may have foggy sight or short-sightedness. If you're having blurry vision at a constant rate, you may want to go for a prediabetes test. Number 3. Fatigue. Although fatigue can be caused by a number of factors, it is often a symptom of prediabetes. Fatigue from prediabetes occurs when the cells of your body fail to take in adequate glucose from your blood. This usually happens when the pancreas doesn't produce enough insulin or when the cells hinder insulin from crossing its outer membrane in what is called insulin resistance. Our cells require insulin to utilize glucose for the production of energy. Since insulin doesn't get into the cells in the needed amounts, glucose is not utilized and you may find yourself getting tired rather too quickly. If you discover that a little walk across the street gets you feeling unusually tired, then you may want to go for a prediabetes check. Number 4. Frequent urination. When we urinate, we pass out waste substances from our body's metabolism. These substances include nitrogenous waste such as ammonia and urea, inorganic salts, pigments from the breakdown of blood, creatinine, water, and for people suffering from prediabetes, sugar. When you notice that you have to use the restroom too many times within a short period, it may be a prediabetic sign. Urine is formed from blood filtered by the kidneys. When someone is prediabetic, that person has an unusually high amount of blood sugar, which the kidney has to filter out into the urine. The urine then trickles down the ureter into the bladder, where it is stored until you relieve your bladder's content. The kidney will have to repeat this process over and over again just to eliminate the high concentration of blood sugar. So if you pee too frequently, you might be suffering from prediabetes. Number 5. Being obese or overweight, especially around your waist. Research has proven that people who are obese or overweight, especially around their waist region, are more likely to be suffering from prediabetes. This is a very strong correlation between high BMI and prediabetes symptoms. BMI stands for Body Mass Index, which is used to indicate if one is overweight or not by finding the ratio of your body weight to twice your height in meters. Studies suggest that if your BMI is above 25, then you should be worried about prediabetic symptoms. This is because for people who are overweight, the cells of their fatty tissues have to metabolize more nutrients than normal. This overworks the cells and causes inflammation, which triggers the release of proteins called cytokines. When cytokines get into the cells, they stop insulin receptors, which makes the cell resistant to insulin. Since insulin cannot get into the cells, glucose cannot be converted into energy, so it finds its way into the blood, causing prediabetes. This is why health experts suggest that if you are overweight or obese, you may need to find a way to prevent prediabetes. Number 6. Sleep apnea. According to the National Institute of Health, approximately 18 million people have sleep apnea, with up to 80% undiagnosed. If you experience sleep apnea, your breathing frequently stops then starts again during sleep. In those periods, there will be a buildup of carbon dioxide in your blood, which may cause insulin resistance. And as we've discussed, insulin resistance is a precursor to prediabetes. Sleep apnea is recognized as one of the prediabetes risk factors. So, if you have sleep apnea, you should be concerned about the possibility of developing prediabetes. Are there other prediabetes symptoms you know of? How can they be spotted? Let us know in the comments below. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.